Stay on with us. Now, let's get you an overview of the coronavirus outbreak across the country. Now, India's coronavirus tally is nearing the 8 lakh mark after a record single-day spike of over 26,000 cases on Friday. While the positive cases show no signs of declining, the good news is that recoveries continue to outnumber the daily increase in active cases by a huge margin. While active cases are 2.7 lakh, recoveries have crossed 4.9 lakh. India's fatality rate has declined to 2.72% and the recovery rate has improved to 62%. Maharashtra, which continues to remain the worst hit state, has now announced a total lockdown in Pune and Pimpri Chinchwad from July 13 to the 23rd of July. In Bihar, 10 districts, including the capital Patna, have gone into lockdown. The Kerala government has also extended curbs in the state by another week. Yeah, Sneha is still with us. Sneha, who tracks the health ministry. Sneha, despite being the third worst hit nation, our fatality rate is one of the lowest in the world. How is the government planning to keep that low?
Well, the government is saying that the trick here is to ensure that there is quicker diagnosis of the patients and timely management of severe infection, and that's how we can keep the fatalities low, is what the government is saying. 3.4% was what we had about 12 days ago. We are down to 2.7%, and that is assuring you right. The government has also pointed out that among the deaths per million population, India is actually the lowest in the world, even in terms of the absolute percentage of 2.7%. The global average right now is somewhere between 4.5 to 5, if I'm not mistaken. It was as high as 6 and more than 6, in fact, in previous days. The fact is that this is something the government is taking assurance from. However, what also seems to be working in our favor is the fact that our demographics is of a relatively younger population. This is what the government is essentially attributing it to. There was a report essentially that I picked up from certain sources within the Integrated Disease Surveillance Program network, which had said that 43% of the mortalities are among people in India who have no underlying healthcare conditions. I did put this question to a source a few days ago within the government, and I think they're very cagey about this entire issue, is what I could understand, almost like brushing it under the carpet. The government, however, continues to maintain this, that those in the senior citizen age category are the most vulnerable, which is a fact even not just in India but even globally. But timely management of severe patients is what is going to ensure that the death rate is stable. Right now, it is stable and it should not increase. That's also been the message really from the is very, very natural. We've seen more than 26,000 cases yesterday. There is a possibility of that being higher or maybe around the same, or maybe even lower, but that's going to increase in days to come as we open up even further. We know that we're opening up even further. The people are moving around the country. It's a communicable disease. There is enough evidence and more also to see that to an extent, it is also an airborne disease, at least in closed spaces. So all of these factors are there. A vaccine certainly is far away. Nobody really is buying that argument of a 15th of August deadline, to be very honest with you. Yesterday, there was a parliamentary standing committee meeting of the Science Ministry, of which presentations are made.
Sorry to interrupt, Sneha. I want to get an update from Uttar Pradesh as well. We're joined by Pranshu Mishra, UP Bureau Chief. Pranshu, Uttar Pradesh is on lockdown over the weekend. Explain the government's logic behind this 55-hour lockdown. What does it aim to achieve?
Yes, see, of course, there's a number of rising cases. UP is showing the regular upward graph. And in fact, yesterday, we recorded the highest number of COVID patients so far, the mark crossing the 1,300 mark. So that's really alarming. Now, second thing is the state is already under the drive where they are, fighting out the spread of contagious diseases, which generally happens in the monsoon season. So 2 days of lockdown will see all government agencies going in a full drive. Sanitization, most of the public places, especially the market, the fruit markets, the vegetable mandis, the sabji mandis, so all those would be sanitized. That's why this lockdown has been ensured. So though government is not calling it as a lockdown, it is actually saying it, a 2-day special drive. But the fact remains that all markets will remain closed, apart from temples and government offices, even the private offices, they have been asked to remain closed. So that technically means it's a sort of lockdown. Plus, it's the second Saturday today. Therefore, most of the government offices are likely to be closed automatically, second Saturday being a gazetted holiday. So in that sense, we are expecting to see far much less number of people out on the streets. And cops, of course, have been instructed to ensure a very tight vigil, which has started from 10 p.m. yesterday and will continue up to 5 a.m. on Monday morning.
Thank you, Pranshu, UP Bureau Chief, for that update. And thank you, Sneha, who's tracking the Health Ministry, for that comprehensive overview. Now, Karnataka has become a big worry in the country's fight against the coronavirus, with its capital, Bengaluru, emerging as a new hotspot. The state recorded over 2,300 new cases for a second consecutive day, taking its total tally to cross the 33,000 mark. Nearly half of the cases are coming from Bengaluru, with 1,400 cases just from the state capital. Now the city is struggling to find beds for patients. CNN News 18's Revati Rajivan called 31 hospitals to check the status and finds that an opaque and complicated system has left citizens confused. Watch this report.
Until the end of May, Bengaluru had patted itself on its back that it had reined in the spread of COVID-19 to less than 400 cases. But once the lockdown was lifted, there was a sudden escalation in numbers. The past week alone has been particularly bad on the city's health infrastructure, with over 8,000 active cases. So how soon can one find a hospital bed when one desperately needs it?
The person you are calling is not answering.
We called 31 hospitals, all listed by the government as having COVID wards. We got through to just 10. The rest didn't answer, the number was wrong, or even in one case, the hospital was under renovation. None of the 10 hospitals that answered had a bed for a critical patient struggling with breathlessness.
This is the 30th hospital that I'm calling, 30th call. So far, 29 calls, no result. I have a list from the BBMP that gives me the data of how many beds are available as of today. ICU beds and ICU beds with ventilators. And according to this data, one of the hospitals that has bed available, according to that data, is Manipal Hospital. There are 5 beds available, 1 ICU bed and 4 ICU bed with ventilator. Let's try and reach out to the nodal officer of the hospital to see if in fact they do have beds available as claimed in that data from the BBMP.
Hello?
Hello, Madam, Manipal Hospital.
Yes, ma'am.
Ma'am, somebody I know is experiencing breathlessness. I just wanted to check if your hospital has bed available for critical patient.
We cannot receive admissions directly, ma'am. It is to BBMP.
BBMP has clearly said even if the result is not available, if they have symptoms, then hospital cannot refuse admission.
No. Without result, we are not receiving, ma'am. Because when all the patients are positive, without report, how will receive?
Volunteers recite several horror stories of patients not able to find an ambulance or hospital bed.
July 6, 7 o'clock, I receive a call from a patient saying that he's deteriorating. Somehow, after 2 hours of struggle, I found a private ambulance which was charging like 12K. It was almost like 245. The oxygen cylinder was getting over. And we were all in the panic mode. I at least requested that Prashant Hospital people to exchange the oxygen cylinder. I said, we will pay you. You please exchange the oxygen cylinder. But they denied. They didn't even provide us the oxygen cylinder, though they were seeing the patient deteriorating in front of them.
We realized that the fever clinic numbers which were given in the sheets given by the government, some of them are not working. Some of the doctors said they don't do it. Some of the centers said they will not take swabs after 1 p.m., etc. And then even to get a hospital, the government has provided a sheet. But there are 2-3 occasions when I've also tried the numbers, but so far I've not managed to get a bed in any of those hospitals through that sheet.
Data from the BBMP on bed availability isn't encouraging either. 5,062 beds are available for COVID patients in private and government medical colleges and hospitals and COVID care centers. As on July 8th, less than a fifth were free. After a meeting between the government and private hospitals, there are promises that things will be set right. For now, patients will just have to struggle. Revati Rajivan in Bengaluru for CNN News 18.
We're joined by Revati, who filed that report from Bengaluru. Revati, it seems the state government was completely caught off guard with the spike in Bengaluru. Is there an action plan in place to boost the bed capacity, or is even a relocking on the cards?
Well, relocking is not something that the Karnataka government is in favor of. Only containment zones where there are only essential activities allowed, that is the only thing in place at this point of time. There is a Sunday lockdown and complete lockdown on Sundays, as well as a night curfew from 8 p.m. to 5 a.m. the next day. Now, as far as the infrastructure goes, the government is holding meetings with private hospitals. But what we're seeing is in that time, the lockdown period that we had, Bengaluru did not have as many cases. While Delhi, Mumbai, Chennai, these cities saw huge spike, Bengaluru still was not there yet, and there were patients, only half of the beds that were available. So there were extra beds. There were double the number of beds that when you compare the number of active cases. But that period of time which the government had, where you could make preparations, there wasn't really much that was done, is what we are understanding now that the cases have seen a huge spike. There has been an exponential rise, and just yesterday we saw another record spike with 1,400 odd cases in Bengaluru alone, and the mark in Karnataka has crossed the 30,000 mark. So the issue here is that, of course, there are general ward beds, there are beds for asymptomatic patients who could be in home quarantine as well. But when it comes to ICU, patients who require ICU as well as ventilators, that is where the real problem is, because there are several messages and calls that are coming in from people every other day where they are saying that they are finding it extremely difficult to find a bed. They're going hospital after hospital trying to locate a bed, and there is no bed available, as we found when we call these hospitals as well. Also, if you call 108 for an ambulance, the person there tells you that you have to first confirm a bed at a hospital. Only if the doctors confirm it can they send an ambulance also. So critical patients are really struggling at this point of time.
Thank you, Revati, for that comprehensive update. Bengaluru really struggling to flatten the curve. You can catch all those stories on news18.com. Before we go, an exclusive offer on Money Control Pro. Get actionable insights and opinions, make calculated financial decisions